It's the John Dale Show. Like, share and subscribe. Hello folks, John here. Right, got a little bit of time before I've got things to do this afternoon. Let's turn the sound down on myself. Right, a couple of things that we need to go through today. Thanks for tuning in. We've got 4 people viewing so far. How's the sound, guys? Is it coming through okay? Right, here we go. So, first thing I wanted to discuss, and I'm just going to go and grab a URL and then I can come and paste it into Streamlabs. So we'll go straight over to the internet screen and we'll go to browser 1 and I'm just going to type in on here. Oh, actually I'll do it a different way, bear with me a moment. I'll double click that and I'll go straight into there and post that. Right, here we go, let's interact with this then. So as you can see, we've now got the mainstream media talking about freedom passes. Right, like I've been saying from the very beginning, this is all about health passports, digital IDs, COVID IDs, negative test results, papers please, whatever you want to call it. Now finally the mainstream media has actually come about and broadcast this, and this went out a couple of days ago. What's that? 23rd of November 2020 says at the top, 22nd. So this went out yesterday, and this is by Danielle Hussain, writing for the Mail Online. Britons who test negative for COVID twice in a week are set to receive a freedom pass under the government scheme that will allow them to live a normal life. Seriously? Really? Let's have a look a bit further then, shall we? So Britons are set to be given a COVID freedom pass as long as they test negative for the virus twice in a week, it has been suggested. Now, the mainstream media love to roll these things out a few days before they actually go ahead and do things for the government. So be warned. The details of the scheme are still being ironed out by officials in Whitehall, who hope it will allow the country to get back to normal next year. To earn the freedom pass, to earn your freedom pass, people will need to be tested regularly, and providing the results come back negative, they will then be given a letter, card or document, papers please, they can show to people as they move around. The certificate will be stored on a phone, according to sources, and would allow people to live a relatively normal life until the government's vaccination programme gets up to speed. Can you see where this is going, guys? It would be, what was it say? It would even allow Britons to get away without wearing a mask, it is thought, and visit family and friends without the need to socially distance. Isn't our government wonderful? Let's have a quick look at the comments. We've got some things. Sounds all good. I was born, what's his Steam win? I was born free and I will stay free, thank you. I agree wholeheartedly. Let's have a look what's going on down here then. So, a source told the Telegraph they will allow someone to wander down the street. Wow, we can wander down the street and everything. I want one for Christmas. I don't want a card off anyone, I just want a freedom pass. They will allow someone to wander down the street, and if someone else asks why they're not wearing a mask, they can show the card letter or an app. Masks, I mean, I'm exempt, but if anybody asks, I just tell them no. Hey, where's your mask? Sorry, let's carry on through. It comes after former Health Secretary Jeremy Hunt threw his backing behind the Freedom Pass concept. Well, of course he will. Anybody in the government's going to throw their support behind this. His proposal suggests far less testing, however, with calls from Britons to be tested just once a month before being given their certificates. The former Health Secretary has called on ministers to come up with proper incentives for for people to get tested, self-isolate and receive a vaccine. Right, what have we seen in other countries? Let's have a look at Australia first, because they're part of the Commonwealth, aren't they? We've seen that their government, and New Zealand as well, they've started what they call the carrot and stick approach, or what we've got called the nudge unit in the government. Excuse me. And what they're doing is they're essentially blackmailing the public with our freedom. And what they're saying in America, and this is out of Daniel Andrews' gob, what was it he called it? No jab, no play, and no jab, no pay. So the no jab, no pay was, what was it they said? They were going to be taking $30, 30 Australian dollars per fortnight off of people who receive benefits and or child credits and tax credits and benefits until the parents and the kids, or whoever it is in the family, or whoever it is in receipt of getting benefits off the Australian government, get the vaccine. Right? So that's the no jab, no pay one. They're going to start cutting people's money. Well, that sounds like something that they're probably going to end up doing here in one way, shape or form. And what was the other one? No jab, no play. Well, they explained it as that they're going to stop people from going to places. Going to your own workplace, going shopping, sporting events, cinemas, gigs, anywhere. Probably even public parks if they've got a locking gate and somebody that sits on the gate and checks people. And the same sort of thing in New Zealand, exactly the same thing. And I can see this is exactly what it looks like to me. I think that's all of it for this. Oh, here we go. Certificate, medical certificate. There's a little example here. In Slovakia, everyone who tested negative was handed a paper certificate. So there's an example of what the Slovakians have got. And it's got little, you see the bottom left corner, it's got 3 little coronas. Has one of them got a smiley face? If it has, it's a bit cheeky. I can't really see from here, though, because it's too small a graphic. He warned, although the country has Plan A to end the pandemic, a vaccine, it also needs a watertight Plan B. We should go further, offering people who comply with testing and isolation requirements a freedom pass that removes the requirement to follow lockdown regulations. Hooray! Now, not having this. So that's the Daily Mail from yesterday, and Britain, yeah, so there you go, that's the first one. Right, let's go and have a look at the second thing I wanted to talk about then, because I've got 3 things that I want to go and get the next link to. Another mainstream media one. Oops, what's it gone on to? I've clicked an advert. That's the trouble with newspaper websites. They're just full of bloatware. This one's good. So this is from the Mail Online again. And this was on the 20th of November by Ross Clark for the Daily Mail. Let's go back onto Streamlabs and we'll go straight over the one that we've just been using because we don't need that one anymore. Boom. Right, here we go. What they don't tell you about COVID. Right. Let's interact with this so that I can see what the crack is because it's in a small window at the moment. Let's just enlarge it. Okay. What they don't tell you about COVID. Fewer beds taken up than last year. Deaths a fraction of the grim forecasts. 95% of fatalities already had underlying causes, which we know as comorbidities, and how the facts can be twisted to strike fear in our hearts. Well, haven't they just? So, top bullet points. Despite the fear-mongering, the number of COVID-19 deaths is significantly lower than the peak back in April. So this is talking about the second wave. Latest ONS estimates show that in the weekend in November the 14th, new infections were already levelling off. GCHQ has embedded a team in Downing Street to provide Boris Johnson with real-time updates of COVID-19. Analysts will sift through the vast amount of data to ensure Boris Johnson has the most up-to-date information. Well, isn't that kind, GCHQ? Are you listening? That'll knacker their headphones up. Right, what's it say then? So, this was on the 20th of November. Let's have a good look at it then. So here we go. We've got some propaganda about everybody wearing loads of PPE. And look at these gas gas masks they've got on. It was revealed this week that GCHQ has embedded a team in Downing Street, blah, 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 blah. Now then, we've got some graphics here. We'll go straight to those bits then. So this one here is death predictions and reality, and we've got winter scenarios for COVID deaths in England versus the actual. And on the left, you can see the box. It's got Warwick University in the pink, Public Health England, Cambridge in the blue, Imperial in purple, and London School of Hygiene and Tropical Medicine. We know who they are, don't we? There he is. Witty. Right. Let's have a look at what they've said then. So, Public Health England had this massive blue ramp up for now, by the looks of it, isn't it? No, hang on, let's have a quick look. Oh no, this was 2019. So, over the winter, Public Health England went up massively to an estimated 4,100 deaths. Warwick with a pink line, they were sort of along the bottom. Imperial College were in the middle, and the London School of Tropical Diseases was about the same as Warwick. Now the actual is the big thick red line at the bottom, as you can see. And what have we got? I'm just having a look at this actually. This is... Right, yes, sorry. This is September 2020 and forecast to June 2021. My apology. So this is what they're trying to say. This big curve that you can see in the graph with the blue line, this is what the PHE are estimating for this winter's COVID deaths. And it's actually just scraping along the bottom. Now, something to point out as well. Let me just move that one out of the way for a second, and I'm back to me for a sec. Where is it? Is it going to come back to me? Oh, it's playing up. Let me just... Oh, there we go. It's all right. The software's delayed. In fact, no, I shall go back to the browser one because I'll carry on talking. You can see me in the little window. That'll do. Right, so... Let's have a look a bit further down. So we've got the forecasts and we know what it is. And what I was going to say just was, since week 12 this year, the flu has fallen off the graph. It's nowhere to be seen. It's just a zero straight along the line. And in its place has come COVID, as we know. So there's Witty Boy, hands, face, space. Ah, they forgot to put his Build Back Better poster up, didn't they? With a bit of blue tack. Right, next graphic, here we go. Critical care can cope. 2 COVID waves compared. So the new COVID patients admitted to critical care England and Wales and Northern Ireland by days, and later figures are likely to be revised up. So the March, what are these? And let's just have a look at this then, what we got. So I imagine, what it's not actually, sources, the Spectator, no, it's not actually telling us what each one. So if March the 1st, we've got this ramp up. Ah, this is patient figures. Sorry, guys. I'll get my brain into gear in a second. So this is patients in hospital by the looks of it. So we had about 400 patients in hospital in intensive care. And then from September onwards, we've got a much, much lower figure. NHS England bed occupancy. Here we go. So the 2019 average across the top there with the sort of lilac line with a white border around it, around the 120 beds. Total occupied in 2020 is still below 2019's figures with the scribbly green line. And the COVID-19 occupancy, you can see there was a little bit in April. So we had about 20 people in intensive care in April, real figures. And then we had practically nobody in intensive care over the most part of the summer. And now we're just on about kind of, 10, 12 people in intensive care. Intensive care picture. Here we go. Beds aren't fuller. Critical care bed occupancy rates versus the 5-year average. So the 5-year average is going to be the bluey bits that we can see in the background. And November the 8th, 2020, this snapshot shows that all of the areas of the country and all the hospitals and the hospital trusts were less. So there isn't an increase in bed occupancy at that snapshot. Here's a picture of a Nightingale Hospital. This is Sunderland's Nightingale Hospital. They're all bloody empty. We know about that. Here we go. Fatalities are barely any higher. Okay, deaths per week this year. So we can see around the week 12, 13, 14, 15 mark, we've got the big red line where we had the mixture of untreated flu people when the week 12 conversion come about. So they stopped treating people for flu and said they've got COVID, and we haven't got a solution to that. Then we've got the drop down, and it carries on, and there was a dip around week 31, 2, 3, 4, 5, and then it's starting to slowly creep back up a bit. Then we've got, what's this, deaths per week this year in the red, minimum deaths per week over the last 5 years in the blue, maximum deaths. So we want to look at the green line versus the red line. So we've got the big peak in April, May time, which we know about, which is a mixture of untreated flu deaths, care homes being knackered up with people being flooded into them, and all the vulnerable old people with whatever symptoms and problems that they'd already got dying without treatment. The number of people that have had hospital appointments cancelled. I mean, in that big red line there, unfortunately, is my own mum. She went into hospital on the 25th of May at the George Eliot and Nuneaton because she'd got water retention that had filled all the way from her toes to under her diaphragm, and she was supposed to have had it all drained out in March, and they cancelled the appointments because of the lockdown. And then subsequently she took a funny turn about the 20th of May. About a week later, say 25th of May, she went into the George Eliot. I told them repeatedly what was wrong. It was all the way up to under a diaphragm and she couldn't breathe in properly. And they shook their head, stuck a mask on her face, and basically she faded away and died on the 1st of June at 2 o'clock in the morning. So unfortunately for me, my mum is part of that big red spike there. But as you can see, the most of the red line from about week 23 onwards is below. And if you average it out, it's about the same. So fatalities, the death rate hasn't actually increased. Now compare these figures to what we were told over the whole of this lockdown since the 20th of March. What's this next one? Right, what's this showing us? The Government Scientific Advisory Group for Emergencies, SAGE, said the reproduction R rate, the average number of people each COVID-19 patient passes the disease to, had fallen slightly to a maximum of 1.1 people from a maximum of 1.2, and could be as low as 1 or lower in every region of Britain. So it's not now, by the looks of it. I need to know when this snapshot was actually, because it doesn't say. It might just be now, but we're in the middle. We haven't got a pandemic. This isn't a pandemic. If we got a proper pandemic to the levels that they're pushing, or making everybody believe, it'd be chaos out there. People would be dropping dead on the streets like we saw on the China propaganda that we got from sort of December, January time. People dropping dead in the streets. What's this next one? How many COVID-19 cases are really occurring in England every day? Right, the latest ONS estimate shows that in the weekend in the 14th of November, new infections were already levelling off. So you can see we've got 14th of November is the end of this graph. But we had, where did it start ramping up? Testing started about mid-September. Oh no, sorry. When was the first wave of testing? It was about August, weren't it? Late August. So we've got the ramp up in testing all going absolutely crazy through October. So we've got the 20th of October-ish being the peak of the cases pandemic, or case-demic as people are calling it. And we already know that the PCR test has only got a 7% accuracy. We know that the PCR test has been, it hasn't been designed for diagnosing illness, which is straight out of the mouth of Carrie Mullins, or Mullis. I can never remember which his surname is, but that's the man that invented it. And he's on video saying you shouldn't use this for diagnosis because you can amplify and amplify and amplify and amplify some 40 to 60 times one person's saliva sample, and you can make a whole lot of something out of something. You can make anything out of anything, basically. So we've got this massive ramp up of cases which the government are using to scaremonger everybody into this second lockdown and this second wave and all the tiers that they've got going on. Next then, what have we got down here? Number of infections per day in the UK. 7-day rolling averages in blue. So infections per day, right. Are these infections actually illnesses, or are they just cases? You see, the thing is there's a lot of us that now have started believing that part of this lockdown measure is to bottleneck everybody where they want to go shopping. Now, if you have everybody queuing outside a supermarket, waiting to get in, or queuing at the tills, or queuing down the aisles because the shops have gone crazy, then everybody's still got their bloody Bluetooth and track and trace running if you bother to download it. So get rid of the what is it we call it, the Serco track and trace, delete it. And these days you have to have your Bluetooth turned off, because if you're standing in a queue outside a shop and one person out of 20, 30, 40 people was declared COVID positive by a test with a 97% inaccuracy, you're probably going to get a text message through, and then you're going to be added to the pile of these cases. Because there was a day the other day where it was like 33,470 cases in a day. Where from? Where's all these tests going on? I mean, we've got weekly tests going on in care homes for the staff. Monthly, I think it is, for the residents. Hospital staff, they're getting tested. But how have they managed to just get 33,470, and they're calling them infections, making out like 33,000 people all got the flu all in one day? Well, let's have a look at that compared to deaths then. So this, here we go, look at this. You've got 35,000 is the resolution on the top graph, the number of infections per day. And if we compare that to this one below, it only goes up to 1,300. And if you look at where 1,300 would be on the top graph, all this red figure, if it was applied to the yellow above it, would just be this tiny little line scraping along the bottom. So that ain't a pandemic. But deaths in the UK, right, let's have a look then. So we've got from the beginning of lockdown, we've got the massive rate of death per day in April, May, which was the care homes, untreated people who would got operations outstanding, and any other. And then it dies all the way down, and then we've got about 500 people, I don't know, 300 people a day, roughly. 7-day rolling average, yeah, about 350 people a day, roughly, dying of what? Because they haven't disclosed that here, and I'd have to look into that a bit further. Right, that's the end of that one. So that was Mail Online, What They Don't Tell You About COVID, from the 20th of November. Let's have a look at the next one. This one's interesting. This is on YouTube as of the 16th of November. Where is the share button? There we go, copy that link, go back to OBS, close the interaction down there, and double click the browser. Let's get rid of that one, and here we go. I think this should start playing, and I'm just going to check for sound. Just make sure that we've got browser 1. We're not getting any sound through. We're getting any sound through? No, it's not giving us any sound there for some reason, but it should do. We're not getting any sound through. We're getting any sound through?
Toothbrush.
Ah, right, here we go. It's going to come through now. What's this then? This is an advert. Get rid of that advert. I think I need to interact with this. Let's get rid of that. We don't want an advert.
More than 90% of my patients had dental decay problems.
Oh, come on, get off the advert. I don't want an advert.
These patients all
right,
had one
this
thing in
video,
common.
live TV. Let's just
They all
go
used
back to this a
ordinary
second. Bear with me,
toothbrushes.
guys.
I never thought that manual and electric toothbrushes
Going to
could
get
be
rid
that
of
bad
that.
for
Going to
your
go to
teeth and
interact, and I'm
gums.
going to click on skip ad. Right, here we go. Hugo talks. This is what we're after. Let's turn my sound down on there.
Hello, you're listening to
Okay,
Hugo
so what we're
Talks.
seeing here
Well, this
then,
is a
from a
good
few days
example
ago, is
of
Denmark have
the
had
power
a
of the people
9-day
and also the
protest
power of the
ordeal
media,
by
because I
their
haven't
public
heard anything
in
about
massive
this,
numbers,
not through the usual news
and they've all been
channels
standing
or
outside
even the
their parliament
alternative
building,
news channels.
banging
At this
pots
moment,
and
there is
pans,
literally
because
nothing
what was going to be
about
coming
what's just
into
happened in
Denmark.
Denmark. The
Just
government
make sure
in
that I can
Denmark
hear me
had
over the rest of
proposed
it.
a
I
new
ought to get my headphones
epidemic
on, actually.
law.
I'm just going to turn this
which is
down a
not
bit for a
the-
second. Anyway, so Denmark have had a 9-day protest because there was draconian laws coming in like they're trying to do here that were essentially going to force people to be tested and vaccinated and force people into isolation. So their people got up and protested. Where are our people? Such a disappointment. But in the short and long of it is that Denmark have actually succeeded. They've won 9 days worth of people power, and the government has had to relent. They've had to renege on the draconian law. And all they did was stand outside Parliament for 9 days banging pots and pans. And then this lady here, she goes on to explain how good it is, and she looked like she'd been in tears. And she did show a little bit of video of what we were actually looking at as well. There you go. That's her looking at it on her screen. So Denmark have done it. Sweden didn't have all these draconian measures to begin with, and they've had the lowest death rates of all of the countries in the world. We just need to sort our lives out, guys, because we're right at the point now. The mainstream media are saying what we've been saying months and months and months ago. Health passports are going to remove our freedoms, and this is the last bit I'm going to touch on because I've got something going on at 3 o'clock, so I'm keeping my eye on the time. If we have health passports, they are going to remove all of our freedoms. It's going to turn into a papers, please situation. So anybody can get stopped by the police and harassed and forced to give all their information. And the police are already abusing these powers because they're using them to get the information out of somebody using COVID legislation. And then once they've got people's names, date of births and identification, they're then whacking other different fines or prohibition notices and all the rest of it onto these people. And it's the main problem I've got with it is this. Let me figure out how to explain it. If we want to go around shopping, go and do anything we want, go to work right now, we can do anything we want. Nobody stops us unless we break the law. It doesn't matter if we've got mobile phones tracking us, CCTV, ANPR registration plates, credit card payments. You can have your phone in your pocket with GPS or whatever. It doesn't matter because none of these things stop us from going about our day. Now, if it gets to a situation where we are forced to have to have health passports in one way, shape or form, whatever it may be, a wristband, a QR code, a certificate on your phone screen, the end game is going to be that unless you abide by these draconian rules, you aren't going to be allowed to walk into the building where you work, because the government are going to force all the companies to enforce this at the door. They're going to have scanners. If you've got, it'll either be two-way. If you've got a QR code visible on your phone screen, you'll have to present that to a scanner or to a member of staff who's got another phone, because they've got that 2-meter thing where the phone looks at each other and it sees the QR code from a distance, so you keep your social distancing. Or if you haven't got a smartphone, you'll have it on a wristband and it'll have a tiny little QR code and it'll be beep, and you'll have to do that. And if you don't have the tests, or if you refuse, and if you don't have the vaccine, or whatever the other rules are going to be, you will be banned from walking into your place of work. You'll be banned from going shopping. Schools, cinemas, theatres, gigs, everywhere. Public transport, aeroplanes, going on holiday, right? So you'll be a slave to this system. Now, I've said this before on another video that I did on my other channel, but here's a premise for you. I'm a wedding photographer and videographer, and I've been doing this for 24 years. I've shot over 1,560 something weddings, and I have a 100% reliability record. I've never been ill enough that I've not been able to do it. Can't hear over the vid. Oh, that was an old comment's just come through. Yeah, I've just got rid of that. Yeah, can I post the video of Carrie Mullins PCR is not good for testing infection? I'll have to find that out because I haven't got time at the minute. I've got a video consultation with one of my own customers at 3. Right. Yeah. So me being a wedding photographer, I'm a sole trader, self-employed, I work alone. Okay. Now, I say we're in papers please time some point next year, and we're forced to have vaccines, and we're forced to have negative certificates or digital IDs or whatever. Now, you could be standing outside a shop in a queue, and then you get Bluetooth tagged against somebody, and that person was COVID positive, and now they've passed this positive digital signal to my handset, and now I get a text message off the government that says that I've now got to be home prisoned for 14 days, and I was about to walk out the door to go and shoot somebody's wedding. And then if it's the summer, I might have weddings every single day. So now that means that I'm banned from going everywhere for 2 weeks, even when there's nothing wrong with me. And I've got to phone all those customers up and refund all their money. And that would put businesses out. That would put me out of business probably. That would put other wedding suppliers and other sole traders out of business because they have to earn their money. And they can't go cancelling on people because you don't get sick time when you're a wedding supplier like I am. I'm a primary supplier, which means I have to be there on the day. There's only one of me. I can't be in 2 places at once. And even if there's a photography company that has multiple staff members, if they all work together or in the vicinity, they'll all be banned. You won't be able to go and assign photographer A to go and do photographer B's job because photographer B has been flagged as might have COVID from something with a 90% inaccuracy. So that's from my perspective. Now, what about the bride and groom? What are they going to do? You know, they've planned their wedding, it's getting close to the day, and within a week or two of the wedding, 1 or 2 of them get flagged as being COVID positive. Or they don't pass the test because they've gone and had a test, and they've looked for RNA exosomes that aren't a COVID-19 illness. It's the byproduct of your immune system finding an orifice to exit the body, and if it's a chest infection, you're supposed to cough up the phlegm and spit it out. So then they can't go to their own wedding, right? So everything's ruined. What about you? You book a holiday for in the summer, you pay for your flights, you pay for your hotel, you pay for everything. It could be however much. You book your time off at work. A lot of people can only book time off well in advance of the day, and everybody... you might be working in a skeleton crew team, especially these days where they've had to reduce the number of people working in close proximity. So you can't pick and choose your holiday time. So then it gets close to the day that you're supposed to go on holiday, and then you get flagged and you can't go. And you can't change your holiday time with your employer because there ain't no other availability, and you lose your holiday. And you can be damn sure that insurance companies aren't going to cover people. Nobody's going to cover people for in the event that I end up COVID positive, I get XYZ cover. Nobody's going to cover for that. So if this system starts, or even if you feel absolutely fine, you've had your vaccine, you've had your test, everything's hunky-dory, you walk into the airport and then they go psst with the gun at your head, the temperature gauge, and you fail the test. Sorry mate, you can't come on the plane. Do you see what I mean? You see where this is going? The reliability of a human being will be voided. Nobody will be able to plan anything in advance. Nobody will be able to plan a wedding or a function or an event or a holiday because they'll all be at the beck and call of some random, stupid, sensical not vaccine, illness that doesn't even affect them. Just have a think about that for a minute, guys, and just let it stew in your head for a little bit. Because we're getting to the point. What's this reminder? Oh, this is me 5-minute, 10-minute reminder coming up for me appointment. Just have a think about that, guys. We've got mainstream media reporting on exactly what all us tinfoil hatters have been saying since March, and many of us have been saying for years. And it's just going to collapse society because nobody will be able to depend on anybody else because we'll all be at the whim, beck and call of an imaginary virus that could imprison us at home for 1-2 weeks, whatever. And even if you have a snivel, oh, I've got a cold, get away, get away, oh. Everybody's turned into germaphobes. They're all running around avoiding each other down shop aisles. I mean, I'm exempt from wearing masks. I go into Asda or Sainsbury's or wherever, and I'll go down an aisle and people will be like, giving you the eye. And then you'll go near somebody to grab a product and they'll start darting away because you've not got a mask on and they're all germaphobes. So it's going to collapse society. We need to do what Denmark have done. We need to make a stand and we need to say no. And we need to do it now because we're at the 11th hour, basically. We're at the juncture and it's not going to change unless people change it. Right, guys, that's all I've got time for at the minute. I'll what's the time now? For 1:45. I better crack on and get everything else ready. I've got a wedding customer thingamajig to do. It's good that people are still booking weddings, but you know, venues are doing lots of half-price mega deals for next year and the year after for people that want to choose a Monday to a Thursday if you're getting married. So you might get a half-price deal with the venue because it's the venue that costs the most. So yeah, you know, bookings are still coming in slowly but okay, and the business is doing okay. But you know, it's a good job I'm not a DJ. I feel for all my friends that I've got that are DJs because a lot of them have already gone bust. You could see on eBay or other second-hand auction sites and sales sites where they've had to just stick all their DJ equipment up online, all the PA gear, and nobody wants to buy it because nobody can bloody well use it. And I think the only people that would be buying cheap PA gear are the ones that take them to protests. But if you remember what happened on the 26th of September in Trafalgar Square, the tactical support unit came in just while David Icke had finished and the German doctor chap was doing his talk, and he'd only just started. And the TSU came flooding in like thugs, smashing into peaceful people that were just standing watching and listening to talks. And their primary objective was to nick the PA. Right, I'll be on again as soon as I can, guys. I'm going to keep my eyes peeled for some news flashes. And starved into submission, somebody's put. Let's have a quick look at these. What we got? Audio's good. Like we need permission. East Germany ? Steam win. I don't know what that bit was. It must have been from earlier on. John's expression cracks me up. Witless, Chris Witless, yeah. Take Hitler's back in charge then. Take it in Hitler's back in charge then. Yeah. Fourth Reich commiserations, John. I don't know what that is. Can you post the video? Right. Have a look around for Carrie Mullis's video talking about the PCR test. There is a video floating about on YouTube where it's called Eureka Moment, and he actually talks about the design and implementation of the PCR test. But I don't think it's that video that's got the one that says that you're not supposed to use it for diagnosing illness. I think you'll have to look on other platforms rather than the ones that are controlled by Silicon Valley. That's all I can say. So yeah, have a look for that because he did say it. And it'll be around, you know. They're trying to keep it offline, you know. That's why it's probably been deleted from YouTube or blocked from being found on YouTube, you know. Right, so thanks very much for everybody watching and listening. We've got about 13, 14 people watching. And yeah, enjoy the rest of your day then, folks. And I shall speak to you soon. Thank you very much. Is it going to go off? I'm waiting for hard drives now before it'll... There you go. Thanks, guys.